Hello everyone, my name is Nora Rosario, and my Humanities and Global Studies capstone topic is maternal health, exploring ways to protect mothers. In 2017, 810 women died every day from preventable complications related to pregnancy and childbirth. For my project, I focused on two key regions, South Asia and Sub-Saharan Africa, who represent the world's highest maternal mortality rates. I also focused on the US. The US has the highest maternal mortality rate of any developed country. Outcomes for Black and Indigenous women. For the focus of my US part of my project, I explored why outcomes are so poor for Black and Indigenous women. Lack of investment in Black and Indigenous communities. Especially for Indigenous communities, lack of local health care and no way to reach medical professionals contributes to the lack of investment and overall poor outcomes for Indigenous communities. Systemic racism within the medical system. Indigenous women and Black women are two of the most oppressed groups in our society. Black women do not seek out care over fear of discrimination. A study found that 30% of Black women reported having been discriminated against during a medical visit. Historic lack of value for Black and Indigenous women. If we do not value Black and Indigenous women, they will not receive the care they deserve. I also want to acknowledge these are very simple explanations to an incredibly complex question. There are many levels that go into addressing the maternal mortality crisis in this country. Mortality globally. South Asia and Sub-Saharan Africa, the world's poorest regions, suffer from the highest maternal mortality rates. In 2017, of the 295,000 women who died during following pregnancy and childbirth, the majority of their deaths could have been prevented. Sub-Saharan Africa and South Asia together represent 86% of the global maternal deaths. Factors include poverty, distance to facilities, lack of information, inadequate or poor quality services. Globally, poor communities with high maternal mortality rates have components like poor hygiene, with lack of essentials like running water or clean water and sanitation units. Another factor is cultural beliefs and practices, hesitation in terms of medical intervention or receiving care from non-community members. This was a topic I was already familiar with, and I knew I wanted to do a project centered around global health, but also an issue that was relevant to the United States. I discovered the United Nations Global Goals for Sustainable Development, Goal 3, Good Health and Well-Being, Target 3.1, by 2030 reduce the global maternal mortality ratio to less than 70 per 100,000 live births. I also wanted to initiate a conversation on the importance of accessibility to equitable healthcare. For the interview portion of my project, I spoke with two healthcare professionals. I first spoke with Ms. Lyko, a nurse in Baltimore. Through this interview, I was able to gain firsthand knowledge on the status of maternal health in the U.S. She shared insight into what mothers can do to protect their own health and the importance of advocating for themselves. I also spoke with Dr. Creer Perry. She's the president and founder of the National Birth Equity Collaborative. We discussed further systemic racism within the medical community. She said if we want to solve healthcare inequality, we need to stop telling people of color what they need to do to improve their health and start saying what we need to do to undo racism. People believe health is genetic and a choice, but not a right. We need to agree that all people are valuable and health is a right for everyone. My experiential aspect, the Educate Girls Globally Club will be holding an Amazon wishlist fundraiser this spring. It is in support of our 4 fellows who we have been working with for the past few years in India. This wish list would include various essentials like school supplies and sanitary napkins. Supporting women's reproductive health and education is essential to improving the maternal mortality rate globally. Lastly, I will share proposed solutions. Care workers will remain the most key aspect for improving maternal health. To reduce maternal mortality, women need access to trained and equipped healthcare workers that are in communities because many women are hesitant to get care due to distance. Healthcare workers are essential in saving lives of both newborns and mothers during pregnancy and birth. Trained medical workers can not only provide care for mothers during childbirth, but also can provide information on sexual and reproductive health, proper nutrition, breastfeeding, and vaccination. Another proposed solution is providing for and supporting community-based health. In 2017, the United Nations Children Fund created 3,000 midwifery kits and distributed to healthcare facilities across northern South Sudan. Gifts provided many essential items such as folic acid, antimalarial drugs, and oxytocin. Mothers received kits with essentials like soap, new baby clothes, blankets, and a plastic sheet. Many of the women could not afford these products otherwise. Furthermore, UNICEF and the European Union partnered with the government of Sierra Leone to build 23 new hospitals. They have repaired and expanded maternity units and as well as provided basic utilities like running water, hygiene, and sanitation units. Proposed solutions: the United States. Addressing systemic racism in the medical system. As long as systemic racism exists in the medical system, mothers of color will suffer. Healthcare institutions need to recognize healthcare inequality and racial disparities. Finally, I will speak of two pieces of legislation. In March 2020, Senator, now Vice President Kamala Harris, Congresswoman Lauren Underwood, and Congresswoman Alma Adams introduced the Black Maternal Health Omnibus Act. This bill aims to prevent maternal deaths as well as address maternal health outcomes among minority populations. Approaches to investing in community health like in this bill, would help benefit minority populations greatly. The Affordable Care Act currently provides health care for millions of women, but also has allowed millions of women to gain access to maternal care, particularly Black women who are often uninsured and would not otherwise receive many health care services that are now available through the Act. Not all change needs to happen on a national level. Communities can invest in their own health through understanding implicit bias, reproductive health education, supporting, and most importantly, creating awareness. Thank you everyone for watching my presentation. Special thanks to Dr. Romine for all her assistance, Miss Moore, my mentor on this project, Miss Lyko and Dr. Kriya Perry for letting me interview them, and Dr. Pin for giving me inspiration to pursue this project. Thank you.